Intermittent fasting has been a popular approach to weight loss. There's solid research showing that it also decreases blood pressure, inflammation, and improves diabetes markers. But a study presented at the American Heart Association meetings this week suggests that this type of diet increases the risk of dying from cardiovascular disease by 91%. Now, this health news is dominating the headlines, and our KSTP health expert, Dr. Arkel Giorgio, is here to explain why these results should not create alarm or prompt a change in your eating approach if intermittent fasting works for you. Well, Arkel, thank you so much for coming in here to clear some things up.
I'm pumped up about this
I know
one.
you are.
Yeah.
Just for the viewers who don't know, what is intermittent fasting, and just kind of talk about the study.
Sure. So intermittent fasting is when you only allow yourself to eat for specific periods of times or days during the week. So one of the most common ways of doing intermittent fasting is eating for 8 hours a day, not eating for 16 hours of the day.
Okay.
And just having that be your usual routine. So in this study, what researchers did was to look at data from over 20,000 people that had participated in a survey. It's called the NHANES survey. And in that survey, they asked, how many hours of the day were you involved in eating yesterday?
Okay.
And so then they compared those results to death records to see what the association was between hours of days of eating, duration of eating, and subsequent death. And what they found was the following, what you said in the intro, which is that people who are eating for 8 hours a day or less have a 91% increase in cardiovascular death. So really alarming, right?
Yeah. And so, yeah, that's the thing that people will see is the 91% and will die, from cardiovascular. So why shouldn't people be alarmed?
Let me summarize. So first of all, this is not a published study. This is what's called a poster. Certainly research that's done, accepted for presentation by the Heart Association, but it hasn't been vetted and been shown to be good enough yet to be published in a journal. Number one. Number two, it's not been peer reviewed. That means that other scientists, other researchers haven't really poked at it to make sure that the methodology was correct, the findings were correct, et cetera. And third, it's an observational study. It's looking in the back, in the rear view mirror. And so it's randomized controlled studies that that we really rely on to give us the best scientific information. But let me highlight, so those are all, science-based things. But let me just highlight, this study and these results are based on asking people just 2 times, how many hours a day did you eat yesterday? And Brett, if I asked you, how many hours did you eat yesterday, would you really remember accurately?
Maybe. No, probably not. No.
That's exactly right. So all of these results are based on people answering that question just 2 times about yesterday.
Interesting.
And then they extrapolated to get these results.
So intermittent fasting, it is popular. What do you recommend for people who are doing intermittent fasting? Maybe they're considering it. What do you recommend?
Well, first of all, these results should not alarm people, as we said earlier, and you should know the details of how the study that was done. That's why we're talking about it. And if you are using intermittent fasting and it works for you, maybe review it with your doctor in light of this study, but don't stop doing it if it works for you, because we know that it decreases blood pressure, contributes to decreased weight, and that decreases your cardiovascular risk.
Right.
If you aren't fasting currently and you're considering it, again, talk to your doctor about it and figure out how to get to a healthy weight. But what I wouldn't do is have this be a reason to throw this diet approach out and not consider it at all, because I think these are preliminary findings. It deserves more research. We don't understand how this type of diet really works in the biology. And so all this study is a call for more studies.
Yep.
It's not a call for changing how people are eating.
Yeah, it's important to consult with your doctor. It's worked for so many people. So, Dr. Arkel Giorgio, thank you so much.
Thank you.
All right, we'll be right back.